The feel-good story of 2024 is already here. Owen Monroe, who had surgery for a congenital heart defect in 2022. What's so special about this? Well, he had a first of its kind partial heart transplant. What does that mean? Well, let's first start off with some basic anatomy. I'm blocking the left ventricle of the heart, but what comes off the left ventricle is the aorta, and what comes off the right ventricle up here is the pulmonary artery. Notice they are two separate vessels. Owen was born with a condition called truncus arteriosus, where, strangely enough, there's only one vessel that comes off of both the left and the right ventricle. So all the blood that comes back from the body, which is deoxygenated, and the left ventricle, which is oxygenated, mixes in the heart. In Owen's case, his valve was also leaky. This truncus, as it's called, has a leaky valve and requires a replacement of the valve, and the surgery typically involves separating this one vessel into two. Normally, the source of the new valves and the new vessels are cadavers. That's right, bodies that are no longer with us. The problem with that tissue is it doesn't grow, and that requires the children as they grow to have multiple surgeries, each which carry a significant risk to them. Here's a healthy Owen at 20 months. So what did they do? In a first of its kind in humans, this had been done in pigs, they took valves and vessels from a donor heart and just transplanted those into Owen, giving him valves and tissue that will grow. And guess what? The immunosuppression that he needs to keep this tissue from his body rejecting it is only a quarter of the dose of typical immunosuppression. What the treating team has now done is prevented him from needing multiple surgeries in the future and having tissue that grows with him. The body is truly amazing.